So yes, my name's Alisa, and I'm going to be presenting today with Maria, and we'll be talking about dementia friends and engaging volunteers to build community understanding. Thank you, Kathy, for that wonderful introduction. Okay, so to give you a brief agenda of what we'll be talking about today, first I'll be going over an overview of what Dementia Friends is, in case you're not familiar, and then I'll be discussing the evaluation that I did of the Dementia Friends Washington pilot. And then Maria will discuss the introduction of Dementia Friends to Pierce County and how they shifted from in-person to a virtual program as COVID hit. And then we'll discuss what are some things that we learned from these experiences on engaging volunteers and building strong programs, hopefully. First, what is Dementia Friends and what is Dementia Friends Washington? So Dementia Friends is an international dementia awareness campaign so it exists all over the world. And the idea behind the Dementia Friends program is it follows a train the trainer model. So somebody recruits a group of community volunteers. We call them dementia champions. And it's a wonderful name. And we train them on how to give a Dementia Friends talk. And Dementia Friends talks or sessions discuss first what is dementia in really basic terms, and then how do you communicate and support people with dementia. And that can be whether you have somebody in your family or a loved one who has dementia, or even if you just meet somebody on the street, how do you really support them in an individual way? And the beautiful thing about Dementia Friends is it's a really flexible program. It can, when things are able to be in person, it can be held in your home, it can be held in a workplace. You can integrate it into a club or a book group that you're already involved in, or a church, any sort of setting really. And then now it's now being done virtually. So it's very flexible to fit whatever environment you want to spread some information around dementia to. And the purpose behind the Dementia Friends program is really to spread some basic information to open people's minds to what it is to have dementia, and then what can we do as individuals to fight the stigma and support people with dementia. And it's really to break down some of that fear that so many of us have when we are confronted with dementia or even think about dementia. So I can't help myself when I'm in front of a group of people. I just want to talk about Dementia Friends all the time. And so I'm going to go over what are the 5 key messages, kind of the core ideas of Dementia Friends. And this will help give you a flavor of what the program really looks like. So 1, that dementia is not a normal part of aging. Not everyone who grows old will develop dementia. 2, that dementia is caused by diseases of the brain. The most common type of dementia is Alzheimer's disease. 3, dementia is not just about having memory problems. It can affect thinking, communication, and doing everyday tasks. 4, it's possible to have a good quality of life with dementia. And 5, there's more to the person than the dementia. People with dementia are a valuable part of the community. So you can see from that it really is a pretty basic message that is part of Dementia Friends, which is great. So now you have a sense of what the program looks like. And so how it came to Washington was, here, I'll leave it on this other slide. How it came to Washington was this group that Kathy mentioned, the Dementia Action Collaborative, which is a public-private partnership collaborative of people across Washington trying to better prepare Washington for the growing number of people who have dementia. They were looking for a program that could fight the stigma and really give some basic information to all kinds of people on what it is to have dementia. So they heard about this program and wanted to bring it here. And before doing that, they really wanted to know, or maybe at the same time as doing that, they really wanted to know how effective is this program, because it hadn't been well well researched before. So so I led this project, and part of my study and part of implementing this program was to think about, does Dementia Friends really change people's attitudes towards dementia, or is it not really doing anything? And how much does the way that we implement the program, the way that we roll it out, impact how effective the program is? So we kind of had those two questions. So this picture on the left is a picture of some of our dementia champions. Again, those are those community volunteers who give the talk. So our pilot of Dementia Friends started in September 2018 and went to about September 2019. And again, the purpose of this pilot project was to see how effective is the Dementia Friends program at changing people's attitude towards people with dementia, and then two, how does the way we implement the program impact some of those attitudes? So what we did is we outreached to different organizations. We just used word of mouth. We talked on radio shows, went to conferences to recruit 15 volunteer dementia champions across Yakima County, King County, and Jefferson County. We had, I think, 5 people in Yakima, 10 people in King County, and 1 person in Jefferson County. And across all 15 people, we gave 22 sessions, which was great. And we had a goal of each person reaching 20 people. And ultimately we reached around 214 people. And so before they started giving these Dementia Friends sessions, these talks, we gave them a 3-hour-long training where we kind of had the Dementia champions learn, what does a Dementia Friends session look like? How do you hold it? How do you recruit people? And really tried to emphasize why this program was important in changing people's minds and attitudes towards dementia. And then we provided, as they were going through and giving their sessions, we provided ongoing support, which looked like phone calls every 2 weeks just to see how they were doing. We were available via email and phone calls if they had questions, and then would support them as they were planning or outreaching to people. And then to evaluate it, we had a series of 3 surveys that we had for the participants, the people attending these Dementia Friends sessions. And sorry, just checking on timing. And that happened immediately before the session, immediately after the session, and then 1 month after the session. There were surveys that were handed out. And then additionally, we had 30-minute interviews with the dementia champions. So here's what some of our findings. So the Dementia Friends, this is the impact that the Dementia Friends session had on the attendees, the Dementia Friends participants. So this table can be a little confusing to look at, but you can see for comfort with people with dementia, their scores went up over time. So from before the session to after the session, and it stayed high 1 month after the session. And the same thing with knowledge of dementia. It went up and it stayed up. So from this, we found that this program really does positively impact people's attitudes towards people with dementia. And then our other findings that we had, this is based on those 30-minute interviews we held with each of our dementia champions. They had some feedback for us on how to better engage dementia champions, our volunteers, and also the participants of the program. So the main feedback they had were these 3 categories. They told us that some of the things that impacted their ability to be successful volunteers in this program was what their background was, in their individual background and their individual environment was. So whether they had experience giving presentations, if they had strong social networks where they could easily find people to give these presentations to, and if they had a lot of other commitments, if they were care partners, if they had kids, if they had all these other things going on in their lives, became really challenging to be present and have a lot to give to this program. And then they also discussed the need for organizational support of the dementia champions. So we provided all materials for them, and they said that was essential. Without that, it would have been really challenging to be in that role. It would have been just an extra burden. They also said beyond that, what would be helpful and what would help with the previous comment of it being hard if they didn't have as much experience presenting or they didn't have as strong social networks, that they really, a good way to help with that was to really enhance the training of these volunteer champions and give them tips on how to find a venue, how do you advertise, give us some skills on how to public speak, and then maybe be a stronger mediary between the location where you're going to give a presentation. Let's say somebody wants to give it in at a library. If I, as the administrator of the program, could put them in touch with a contact who has already said they're interested at the library, so they're interested in hosting the Dementia Friends program. So those were some of their ideas to help better support the dementia champions. And then their third comment, or primary comment, was the content of the Dementia Friends sessions. It is a lot of talking about dementia, but not from the perspective of somebody with dementia or a care partner, caregiver. So they said it would be really important to bring in those voices, either having somebody with dementia or a care partner be the presenter, be the dementia champion, or have them come up and say a few words. So those were some of the important things that Dementia Champions said for us to be really successful in our roles as volunteers for this program. These are the things that would be really helpful to see. And I think these are really strong takeaways for programs similar to the Dementia Friends program that has really strong volunteer engagement. So those were all kind of data heavy. And then here are some quotes from Dementia Friends participants, the people who attended the session. This was some of their takes about this. I'm proud to say that I'm a dementia friend. I would like to just say thank you. I didn't know anything about dementia prior to this session, and I really walked away with some good tidbits that I've shared with friends and family. The workshop gave me confidence to help my mother and associate with the residents at her memory care center. This information has great value to me, and I was given the feeling of empowerment. So again, these quotes give you a little bit of a sense of what the program looks like and what some of the takeaways can be. So again, you see that people really connected with the material, and even for people who came in with really not much knowledge about dementia, or maybe had no personal connection to dementia, they were able to become spokespeople for why it's important for us to care and think about dementia and be daily advocates for people in dementia when we come into contact with them. So I think, yeah, this is, after this whole session, after doing this pilot, I was feeling a little burnt out on the program, and then I heard these comments, and it really made me feel like we were doing something important and that this was a great tool. The Dementia Friends program was a great tool to spread information to people who didn't have as much experience with talking about dementia. Kathy? So just to finish up, I wanted to just name the sponsors who made the Dementia Friends pilot possible. So here are some of our sponsors, and then I'm gonna pass it on over to Maria. Just tell me you want me to move on to the next slide.
Okay, I will, thank you. Great job, Alisa. So thank you for allowing me to present to you today. My name is Maria Holt. I'm the Program Director for Dementia Services at Lutheran Community Services Northwest. I just wanted a little bit about me. I've been with Lutheran Community Services for almost a year now, and I worked in social services, mostly with older fosters. The majority of my experience has been in home care and home health and mental health. And for the last 6 years prior to coming to Lutheran Community Services, I was a regional manager for a large private duty home care company. So my experience has allowed me to work with many individuals and families who are experiencing the transitions that come with aging. And I've assisted many people who are navigating the world of dementia and all the challenges that come with that. The picture of me is with my mom, Jean, and she passed away last year after living with Alzheimer's disease for about 8 years. It was ironic that my mom had Alzheimer's because my mom was a nurse, an RN, whose specialty was geriatrics, and she spent her career caring for older adults, many of whom had dementia themselves. I was a caregiver for my mom, along with my dad and sisters, until she passed away at home on hospice last spring. And after she died, I decided it was important for me to work more closely with a program that would add quality of life for people with dementia and their caregivers. So the work that we are doing is very important to me on a personal level as well. And I'll start here with my first thoughts on engaging volunteers, that is so important that you look for people who are passionate about your cause. In many ways, we are all affected. Well, in my work with families and caregivers, I have found that many of us have been touched by dementia in one way or another. And those are the people that you want to reach out to when you're looking at volunteers, as they will be a lot more likely to engage and give of their time if they have a personal connection to what you are doing. Next slide, please. Quick overview of how this came to be. Lutheran Community Services Northwest is a nonprofit. Our mission is health, justice, and hope, and we'll be celebrating our 100-year anniversary next year. We have offices in the tri-state region of Washington, Oregon, and Idaho, and each of our offices has a different area of focus. So in the Puget Sound office in Tacoma, we are all about senior services. The Dementia Services program that I run is funded by a large federal grant from the Administration for Community Living in support of the nationwide Alzheimer's Initiative. And the grant title is A Dementia-Friendly Pierce County. The grant funds 3 main initiatives, as well as some smaller pieces around early detection and behavior management. And those 3 primary programs are Dementia Friends, and then Opening Minds Through Art and Memory Ensemble are the 2 others. All of our programs support the overall goal of a dementia-friendly community, or to take it to another level, you could even call it a senior-friendly community. One way or another, all of us are affected by aging and the challenges and changes that it brings. So my focus today is to tell you a little more about how we are implementing Dementia Friends, how we've been affected by the pandemic and pivoted to a virtual platform, and then along with Alisa, share some lessons learned regarding engaging volunteers. Next slide, please. So thank you to my co-presenter, Alisa, for that overview of Dementia Friends and for leading the way with the pilot of the program. The timing of that was really perfect for us because as the pilot wrapped up, we were getting ready to start our grant work, and Pierce County was the first county to sign an MOU, Memorandum of Understanding, to provide Dementia Friends in Washington State. So as Alisa explained, Dementia Friends is a train-the-trainer model with a master champion training dementia champions who serve as volunteers to bring the Dementia Friends message to their communities. Back in March this year, I met with Mary Grace Becker, who you're familiar with. She's the Dementia Friends state lead for Washington. And we met for me to receive my Master Champion training. I do want to take a moment just to say, in agreement with Alisa, that the Dementia Friends curriculum is great. It's really important information. It's explained in layman's terms, and it's interactive and appropriate for all people. So everybody from clinicians to baristas, from CEOs to front desk staff can all benefit from Dementia Friends. And if you were in the conference yesterday and saw Meredith's keynote, you've seen the Dementia Friends video trailer. It kind of gives a visual overview of the program. And if you missed that, you can let me know. I'd be happy to send you the link to it. So as Meredith mentioned in her keynote as well, anybody that's working in a service industry, whether we're serving people in social services or whether we're serving people in the community, this Dementia Friends is just another level of customer service that we can provide to people. So anyhow, there was a lot of excitement for us at Lutheran Community Services about getting this off the ground. And as part of our grant, we have a wonderful group of community partners, including the Aging and Disability Resource Center, or ARC, which is Pierce County's AAA, Multicare Celebrate Seniority, the CHI Franciscan Parish Nurses, Mountain View Community Center, and Edgewood, to name a few. So it was natural for us that our first group of volunteer dementia champions to be trained included representatives from these partners, as well as several staff from Lutheran Community Services who work with our senior engagement programs. And we held our first Dementia Champion session in early March, and that's a picture of our first champions. We have Caitlin from Mountain View, Deb Gurney from Celebrate Seniority, and then Wendy Morris, Rena Markin, and Nikisha Thornton from Lutheran Community Services, as well as myself hiding in the back. So we're really excited to get out there and start spreading the word of Dementia Friends. And we even contracted with Pierce Transit to place bus ads to help get the word out. So you can see one of our dementia-friendly Pierce County ads on the bus there. Next slide, please. So then COVID came, and like so many of us, at first we were all thinking that this would be short-lived and that we kind of just waited to see what would happen. When it became apparent that we were going to be staying home for the long term, we decided to look at whether Dementia Friends was something that could be converted to a virtual format. So after consulting with Mary Grace, who reached out to Dementia Friends USA for guidance, we determined that as long as the content of the information sessions remained intact, we could indeed get doing virtual version of Dementia Friends. And this is where I would like to say, I don't know if any or all of you have had the same experience, but one of the silver linings to this pandemic, I think, has been that people are so willing to share information, best practices, presentations, lessons learned. I think it really is true that we're all in this together. So I reached out to other states who have robust Dementia Friends programs to ask them, how are you doing this? And I was fortunate enough to receive feedback from several programs, but most specifically from Beth Stoltzberg with Dementia Friends Massachusetts, who generously shared their entire PowerPoint presentation with me. And Beth is actually leading another breakout this morning about virtual programs. So if you have a chance to watch that when we receive the recordings of the conference, please do, because she's an amazing person that's doing some great work. So next steps, we made a few changes to the curriculum, just adding our own pictures. As you can see there, we added in our champion picture and changing up the wording a bit. And then the next step was to reach out to the Dementia Champion volunteers and ask them, as volunteers who are being affected by the pandemic in their own personal lives and their own careers, is this something you feel comfortable doing? And I think that's another important lesson in engaging volunteers, is to be really cognizant of not only what your needs are, but what your volunteers' needs are as well, and to make sure that what you're offering and asking is a good fit for them. So several of our champions were on board to give it a try, and so we started reaching out to the groups we had initiated to do Dementia Friends sessions with. Yeah, and as you can see in the slide, since the transition to virtual, we have been able to add 2 more Dementia Champion volunteers and provided information sessions to 73 Dementia Friends. So I think it's actually a little bit higher than that now. I think it's 77 now. So that was pretty exciting. Next slide, please. So I wanted to offer some tips for transitioning to a virtual format for your programs as well as Dementia Friends. The first thing would be to determine if the information can be provided online without losing its integrity. So Dementia Friends, I think, is a good fit for a virtual program. It involves a lot of talking, which of course can be done in a virtual meeting. And there was already a session workbook that is used for the in-person information sessions that was easy to email to the virtual participants. And that way they had something written to follow along with and refer to. The way we do it, it's almost similar to a webinar, but with some interactive pieces as well. But some other programs may not work in a virtual format. I know yesterday, Debbie with the Puyallup Library Memory Cafes was saying that their programming is on hold due to COVID because it's just not something that lends itself to a Zoom meeting. So exploring that would be a good first step. And then consider your target audience. Our goal is to have Dementia Friends throughout Pierce County. For our initial sessions, we really had to change our vision up and think about who would be comfortable receiving this information in this new format. So far we've done information sessions for many professionals in the community, including some social service providers, home care agencies, library employees, senior center staff. But what we discovered too is I believe that's been successful in part because a lot of those people were already comfortable using virtual meeting formats like Zoom and Google Meets, although certainly not to the extent that we're using them currently. But it's been a little more challenging to connect with others in our target audience, such as older adults in faith communities or family and friend support groups. So some people will have to wait, until we can get back to doing things in person. And as far as the volunteer champions, we've had a couple of champions that are really on board with doing this, and then some that have said, I'm not confident in my own comfort level in running a virtual meeting, so I'll wait until we can go back out into public. One thing that you can do to kind of determine that is we did a survey of our target audiences to find out whether people would be agreeable and interested in doing a virtual session. And then another piece of it that is important when you're looking at your target audience is to make sure that the people that you're reaching out to have the technology to interact and have good internet connections and have up-to-date computers or tablets that have audio visual a comfort level to be able to use those. And then reach out to others who have done what you want to do. So again, my experience has been that the majority of people are wanting to be helpful and are willing to share. If you can find one or more people who are passionate about what you are doing and have the time to chat with you, you can make some amazing connections. And collaboration with others may benefit them as well. They may have questions that you can answer or be able to learn from your lessons. So again, I think the saying that we are all in this together is really true. Don't be afraid to reach out. Creating guidelines for your new model. So be sure that you're updating procedures for your program and that you're getting that information out to those that need it. I discovered sometimes I expected my coworkers or volunteers to know what I was talking about when in reality the new guidelines had not been well communicated. So it's important to put things in writing, update them as needed, and make sure the information is getting out to those who need to know. And then find ways to keep people engaged. So in this new virtual world, I know that some people are probably experiencing burnout on working and learning remotely. I know for myself that there are days when I go from one virtual meeting to the next all day long. And for the volunteers, in particular, many of them sign up to volunteer because they want to help, but also because they really value the social interaction they get and give from being with others. And so if we want our virtual programs to be successful, we need to make sure that we're keeping people interested and engaged. So for Dementia Friends Virtual, as I said, there's some interactive pieces where we ask the attendees to unmute and do some exercises and activities as a group. For larger groups, we can use breakout rooms like we're doing today in a Zoom meeting. And for our volunteer champions, just making sure that we're touching base regularly via email or phone, asking, how are you doing? Anything we can support you with? As Alisa said, do you need any tips on getting things set up? Just so they know that they're not hanging out there in the virtual world alone. And then finally, be prepared to try something else if it doesn't work out. Flexibility is the name of the game in these unprecedented times. It took us several tries to get everything working smoothly with the Dementia Friends virtual model, including the technology piece and figuring out how to get the volunteers trained and engaged. And it's still a work in process. So keep an open mind, seek feedback, and incorporate the feedback that you get if appropriate. And don't be afraid to switch gears and try something new if it's not working out. Next slide. So some data for you. How is Dementia Friends working so far, and is virtual Dementia Friends information as effective as the traditional in-person model? So these charts document our findings for the first year of our grant, which is June 1st, 2019 to May 31st of 2020. So there's two outcomes we're working to achieve with this program. One is increased level of dementia awareness or knowledge of dementia, and one is a decrease in the perceived social stigma of people with dementia or attitude. The participants in Dementia Friends information sessions, similar to what Alisa did, are surveyed prior to the information session, and then again right after the information session, and then again at 30 days. Using a tool, it's called the Dementia Attitude Scale, and we send our survey results to our wonderful third-party evaluator, Charles Emlett, who's a professor at UW-Tacoma, and he analyzes all that data and reports it back to us. So as you can see, there's an increase in knowledge of dementia, a decrease in stigma about dementia, and a significant increase, about 12 points in overall score. And that has remained pretty consistent at the day mark as well. So what that tells us is that the Dementia Friends curriculum is working, that it's being absorbed, and that our Dementia Friends are making a difference in their communities. Next slide. And then the second one, feedback regarding the virtual format versus the traditional face-to-face model, indicates that knowledge gained is pretty consistent in both formats. There's a little decrease in stigma. There's a little bit higher in the decrease in stigma part when we do the in-person sessions, the face-to-face. But it's not really statistically significant, as Charlie put it. And this does support the earlier recommendation about making sure that your program content can be effectively delivered in a virtual format. These statistics show that the switch to a virtual format is still really effective in Dementia Friends. And just another quick thought, this is another area that we needed to pivot, as Alisa had mentioned. In face-to-face Dementia Friends sessions, you hand out the surveys pre and post, in person, they complete them right there. We had to develop a Google Docs survey that we could send out virtually prior to the session and then post-session. So again, just another thing to think about in this pivot to the virtual world. Next slide, please. So ways to get involved. Dementia Friends USA website, which is dementiafriendsusa.org, is a great source of information if you're interested in learning more. There is if there's no Dementia Friends program in your area and you're really interested in doing it, there is an online information session option that you can do on their website. But we highly recommend seeking out an in-person session if at all possible. There's just really something about the interaction with others, whether it's in person or virtual. There's the interactive piece that I think really drives home the information. If you're interested in Dementia Friends in Pierce County, you can reach out to me. I'd be happy to give you more information on that and get you set up. If you're interested in Dementia Friends in other counties in Washington State, Mary Grace Becker would be your contact person. She, I believe, last I spoke to her, the idea is to roll out Dementia Friends in about 3 counties per year. I know that this year we've got King County, Pierce County, and Spokane County getting on board with Dementia Friends. I know that there are also plans to set up a Dementia Friends Washington website where volunteer champions in different areas of the state will be able to connect and people will be able to sign up for sessions. And then, yeah, just another quote there, as Alisa had some, that these types of things are what really makes you realize that what you're doing is valuable. And this was a group, the Beacon Senior Center, that we did the virtual session with, and then they took that picture for us afterwards and, you know, said the Dementia Friends information session was helpful. It changed how they look at people with dementia and changed their level of appreciation for them. And then I think our last slide is when Alisa and I together, we're going to go over some lessons learned on engaging volunteers.
Yeah, thank you so much for that, Maria. It was great. So here are some lessons learned that I had and that we had from our implementation of the Dementia Friends program. So for me, it was really important to take some time to get to know the volunteers, starting from the first time we met, to see if they were even interested. And for me, that was really important. So then I could see what skills, why are they interested in getting involved? What's their motivation? Skills are they looking to gain, if anything in particular? And from that understanding, and what's their background, really get a sense of why they're involved, what's motivating, if they know a lot about dementia or a little. And then from that, then I can target my support. And I think that really helped them and me stay engaged in this process, because they knew they weren't just giving us support in rolling out our program, but they were really being heard and listened to and being supported in the things that they wanted to get out of this, either being an advocate in dementia related issues, or just learning how to be a public presenter, a public speaker, learning some of those skills, or whatever it is. So that was a really important thing for me. And it takes a lot of time and some delicacy in making sure you're not further burdening volunteers by taking too much time to get to know them when they just want to kind of be in their role and focus on that. But it was really important for me to take that time and really make sure I was targeting my support based on that relationship building.
Yeah, and a couple of things that that I would like to bring forward are making sure the volunteers feel appreciated and making it fun for them. Especially, as I said, in COVID times now, where they're not getting to interact on a personal level with people in the way that a lot of people volunteer to do. Um, you know, finding ways to reach out and finding ways to keep them engaged, and you know, those phone calls, those emails. Once COVID is over, set up some coffee dates for champions to get to meet each other. You know, those kinds of things. And then be really clear, like I said, in your expectations and your communication, and not assuming that they know what you're needing, and not assuming that you know what they're needing. And so I think Kathy was kind of jumping in and saying we're kind of at time, so that we have time for some Q&A. So I'll leave it at that.
I think this is really great content, and I think a lot of the information that you all have provided has just been really terrific. And I think some of these points, you know, I think we can have these in part of our discussion. So I wanted to take some of the questions that we've had coming in. One that came in first was from Bruce Dentler, who had to leave the call, but he's going to make sure to listen to the recording after he gets his appointment. And he was asking, why is the word fear used instead of the word anxiety? And it seems to him fear holds a more connotation. Do you have a comment on that, Maria or Alisa?
Yeah, since I'm the one who used fear, I feel like I should take this one. So I think the reason Anxiety definitely word as well. I think fear is just how I've heard people talk about it, have they've used word. I think they've used words like I'm scared of this, or more than just anxiety. I think there's a really deep that a lot of have they haven't had a lot of exposure to dementia, and they don't really, they've just heard some of these stereotypes of what it is to have dementia or what it is to support somebody with dementia, and haven't seen a lot of it for themselves. The that's there, the person that's still there. And so I think fear is just a lot of what I've heard people talk about, but I think anxiety also definitely captures it. But we fear negative, standoffish word. I don't know, Maria, if you have anything.
No, I think that's it in a nutshell. I think that people are they're full of getting it. You know, I know with my family history, I would use the word fear. I don't want to get dementia, but a possibility. There is some fear around not knowing what to do in a certain situation. If you're confronted with a situation where you think this person might have dementia or cognitive issues, you are fearful about, how do I approach them? Do I approach them? What do I do? So, but I do agree. I think anxiety is another great word as well.